Hi, and welcome to this presentation about postpartum depression created and presented by Nazanin Bain, Kate Pananides, and Melissa Goldman. To start off, we're going to show you a demonstration of an initial therapy session between a client who's experiencing postpartum depression and a therapist.
Hi, welcome in today. How can I help you?
Thanks. I've just been feeling really sad. I'm a new mom. I have I guess, yeah, she's 5 weeks old now, and I've just been feeling just not like myself at all. And I don't know. I feel like I'm just really not good at this.
Yeah, thanks for sharing. That sounds a lot like you're feeling maybe some of the symptoms of postpartum depression. Don't worry, this is a very common kind of thing to happen after giving birth. I thought maybe we could start with an assessment and then kind of see where we're at from there, depending on where you score. Does that
Oh,
sound like something you'd be interested in trying?
yeah, yeah. I've never heard of that before. Yeah, that'd be great. Yeah, I see a lot of those symptoms. I mean, I just feel like I can't, like, I've been sleeping at such weird times. I feel like super down and like I just can't get motivated during the day, and which is just really not like me. And I just feel like I'm failing.
Okay, well, thanks for sharing. I did just get your assessment back, and it looks like you have scored a little bit higher on some of the questions that were on the assessment, and it does look like you are experiencing postpartum depression. Um, so, are you okay if we talk about some of the treatment options for that?
Yeah, yeah, that'd be great.
Awesome. Great. Well, I'm glad you're open to this. Some of the common treatment solutions we have for postpartum depression are something like CBT, which is cognitive behavioral therapy. And basically, you come in and once a week, and we go over how you're feeling, and we look at some of your thought patterns. And then we try and reframe some of those thought patterns that you might be experiencing. It sounds like you are having some thought patterns that are pretty common for people who are experiencing postpartum. And I think through this type of therapy, we can really start to implement some new ways of thinking and reframing that are really going to help you a lot.
That'd be great. I feel so lost.
Yeah, and in addition to that, we can also offer you some extra support. There are some great moms groups out there where you can get together with other moms who are also experiencing postpartum. We've seen some great results from those groups. So, that along with the therapy that we do together, I think would be a great way for you to start to feel better. How does that sound?
Yeah, that sounds really good.
Awesome. Well, thanks for coming in today. I really appreciate you coming in, and I look forward to seeing you next week.
Thank you. I really appreciate it.
Thanks, Melissa.
So, from that therapy demo, you probably have a sense of what postpartum depression is. It's a medical condition many women experience after childbirth, characterized by prolonged feelings of sadness, anxiety, fatigue, among other things, that can make it difficult for the mother to care for herself and her baby. Postpartum depression can occur anytime after childbirth, typically starting within 1 to 3 weeks, and requires treatment to improve. Postpartum depression is distinct from baby blues, which are less severe and typically resolve within 2 weeks. So, here we have some more information about postpartum depression. First of all, it's very common. In fact, 1 in 7 women will develop postpartum depression following childbirth. Risk factors for postpartum depression include prior mental health problems, previous or current stressful life events, exposure to interpersonal violence, partner relationship problems, migration, and a lack of support. Up to 50% of postpartum depression cases go undiagnosed due to stigma and privacy concerns, which is a really staggering statistic. Unfortunately, low income women and women of color are less likely to receive postpartum mental health care due to numerous barriers to treatment, such as transportation, financial issues, issues with insurance, etc. Postpartum depression can affect maternal infant bonding, breastfeeding, parenting practices, and marital relationships. And these things can lead to negative outcomes for the child. So that is why it's really important to notice these symptoms and seek treatment right away. So, how do you know if you might be experiencing postpartum depression? Well, you may notice you're feeling depressed most of the time. You're struggling with difficult emotions like shame, guilt. You're feeling panicked and scared a lot of the time. And you're noticing severe mood swings. You may also notice changes in your motivation, your energy levels, your appetite, and your ability to sleep. PPD can also lead to having difficulty bonding with your baby, and thoughts about hurting yourself or your baby may arise. So, now let's talk about what the effective ways of treating postpartum depression are. The first is seeking therapy. The second is finding support groups. This can be online or in person. The third is being prescribed medicine from your doctor, such as antidepressants or estrogen. And the fourth is really taking care of yourself and managing stress through exercise, mindfulness, nutrition. Having a support network during this time is really, really important, and you may be wondering how you can make that happen. So, first, let's look at and understand the different types of support that we need. One type of support would be emotional support. With this type of support, we're looking for someone who can listen and really understand what we're going through. This could come from a partner, a therapist, a family member, or a friend. Practical support is someone who can help with everyday activities like babysitting, cooking, cleaning, or finances. Informational support is when we receive guidance, advice, and useful information, and this could be from a doctor, an educator, or family who have gone through these experiences before. Finally, we have peer support. Peer support has been shown to be one of the biggest protective factors in postpartum depression. This could be as simple as having a text thread with other moms or going to a support group in person or online. Now let's talk about ways to find support. For example, finding a local church with a mom's group would be a great way. Online therapy can be a great option for people living in rural communities or lacking transportation. Starting a text thread with friends or people who have kids, and relying on family members. Here we've listed a few more ways that you could find support, so feel free to pause here to read through those. So next we're going to talk about cognitive restructuring, which is a cognitive behavioral therapy skill. It's a technique used to change the way that people think. So the goal is to replace stress-producing negative thoughts, also known as cognitive distortions, with more balanced thoughts that do not produce stress. So one category of cognitive distortions is all or nothing thinking, where we start to see the world in very black and white terms. An all or nothing type of thought that a new mom could be having is, my life is over, I will never have my life back again. So using this example of a cognitive distortion, let's walk through the cognitive restructuring process. First, let's identify the evidence in favor of and against this particular thought. Evidence in favor of the thought is that your life probably will change. You may have less free time, your sleep schedule will change, and your priorities are going to shift. On the other hand, there's also going to be positive changes. You get to experience unconditional love for your baby, witness incredible growth, and build a strong bond with your child. Now let's consider whether or not this thought is accurate. The truth is that your life after giving birth doesn't have to be exactly the same as it was before or completely different. It can actually be a wonderful blend of both. You can still keep aspects of your old life that you want while embracing new experiences with your baby. Next, let's consider alternative explanations. So instead of thinking, my life will never be the same, what if we think, my life will enter a new and exciting chapter? This thought acknowledges that you are making a significant change in your life while focusing on the positive potential that comes with that change. Now let's evaluate the benefits of the negative and the restructured thought. The negative thought that my life is over and will never be the same can leave you feeling overwhelmed, anxious, or discouraged, while the restructured thought that my life is entering a new and exciting chapter might leave you feeling empowered, motivated to adapt, and excited about the future. So, with that in mind, it makes the most sense to choose the helpful thought. My life will enter a new and exciting chapter. This thought allows you to approach parenthood with a more positive outlook. So, hopefully, that demonstration of cognitive restructuring was helpful to you. And if you're interested in trying it out on your own, we recommend seeking a CBT therapist or purchasing self help materials such as books. We've created a list of resources for you that might be helpful during this time if you are in need of support. We have some websites, some support groups, hotlines, as well as self-help materials and ways to seek professional help. Thank you so much for listening to this presentation. We really hope it was helpful to you, and we hope you have a better understanding of postpartum depression.